Right, guys, a very good evening to all of you. How's everyone? So, we have come here for the doubt solving session for pharmacology. So, how many of you are online? Can you please confirm me? So, I'm there with you on YouTube, so you can directly type a message in this YouTube chat. So, I will be reading this YouTube chat with you. And also, guys, in case you have any doubt and you people are not able to log in through this YouTube, you can directly put a message in Telegram group. So I'm there in Telegram group also. So let me open this Telegram group. So I'm there with you in Telegram group also, right? So in case you have any doubt, please ask in Telegram group, or you can also directly type in this YouTube chat, right? So a total 90 questions were there in our pharmacology paper. And if you ask me, sir, uh, what was the logic of making this paper? So the logic was, guys, I have just accumulated all the important topics, like whatever topics are important in pharmacology and the topics which have been asked in the recent exams. So I'm just following all the patterns of the exams in the recent years very strictly. And I've just made a list of these topics, right, which are important and have been asked in last 4 or 5 years. And accordingly, keeping those topics in mind, keeping all these things in mind, I have prepared this paper. So in these papers, maybe the questions won't be asked. Like there is a possibility that uh, the same questions will be asked in your exam, like in NEET PG exam or any of the upcoming exam, like if you're preparing for NSCT. But like guys, let me tell you, if you ask me sir topics, I guarantee you 80% questions will come from these topics only, right? So like we people are in contact since last 1 year, so you people are continuously asking questions and I'm replying to those questions. What I have noticed, the main drawback which I have noticed, like which I can point it out, like you should not do like this way. The problem is like you people are asking questions from some outdated things. You people are solving questions of around 2011, 2012, or maybe before this 2010 or 11. So if you keep on doing these old questions where the concepts have been changed, the pattern of the exam have been changed, so guys, you will not go anywhere. Like you will not come out with any of the outcome. So my suggestion is just concentrate on the last 5 years papers and just write down the topics which are important and which you think that these topics can be asked, and read only those topics. I always repeat it so many times during my regular batch also, as well as during my recording of this pharmacology app also, that studying more things will not fetch you good rank. It's about the smart study. So how you smartly prepare for the exam, it's more important for you, right? At the end of the day, everybody has so much of material, but out of that material, what all things you have to just catch or what you have to just capture and which you have to read, that is more important to know. So guys, the paper was typically based on the important topics. So if you don't have time to make the list of important topics, you can just go through all the questions of this paper, and whatever topics have been covered and the questions which have been asked in the paper, whatever topics you can correlate with these questions, just read those topics. So this should be your approach for pharmacology, as well as I suggest you the same approach you can follow for the other subjects also. Studying more will not give you the good rank, but studying smart will definitely give you the rank, right, guys? So this is about this paper, and if you ask me the pattern of paper, so the pattern of paper, like the difficulty level of the paper is medium. I will not say it's very difficult paper, and I will also not say it's not a very easy paper to solve, being as a PG aspirant or being as a dental student preparing for the entrance exam. So paper level is medium. Like, so if you're able to score more than 50 to not 50%, I will say if you're able to score more than approximately around 60% marks, it will be good. Like you're going in good direction, right? So 60% marks, if you're getting in this paper, you still have 2 months with you. So in case you prepare for this paper and you revise this pharmacology 1 or 2 times more for your exam, then definitely you can get around 60-70% in your exam. And it's more than enough to clear any exam and you get a good rank with that, right? So the level of the paper is medium. It's not very difficult. Like you will say, ki, sir, we will not be able to understand any of the thing over here. It should not be like that. Like if you're facing this kind of problem that you were not able to solve the questions and you are getting around 25 to 30% marks only, like after attempting the paper with a wholeheartedly, you have spent so much of time, like you have spent whole the complete 1 or 2 hours whatever have been allotted to you to solve this paper, But you're getting less than 25%, then guys, you really have to think about this, your preparation. You have to really think about your strategy, like how exactly you're preparing for the exam. Because I mean, you're not going in, you're making some mistakes somewhere, maybe. So you have to correct your path, right? And if you're getting more than 60%, then obviously it's good. Like there's nothing like that. And getting more than 80%, it's also very good. So this is the one thing, like if you do these important topics, then definitely the success is yours. Second thing is, I told you the level of the people is medium. So you can assess yourself now, like where you stand right now. So if you're finding this paper difficult, then you have to work hard. You have to work upon your preparation. And you're finding this paper easy, and you ask me, sir, what all other things we can do. So guys, also we can discuss on that. So in case, is there any student who is finding this paper very easy, and that student will say, ki, sir, tell us something extra, like these things we already know, tell us something extra so that we can get around 80 to 90% marks, so that with that we can discuss, right? So I can see around 8 to 10 students are online right now. And I have also received few queries, like you people have filled the Google form in which we people have asked you to ask the queries. So I have got a query regarding this morphine poisoning. So one of the student wants to know about this morphine poisoning. So morphine poisoning, guys, morphine is an opioid. So opioids are the painkillers, and patients who suffer from cancer, these people are fond of taking these opioids because they have the cancer, they have a lot of pain in their body, and opioids are the best medicine for the treatment of cancer pain. And opioids have one very big drawback, like whenever you start taking opioids, gradually body become tolerant to the action of opioids. So body stop responding, body mechanisms stop responding to the action of opioids. And this phenomena is known as tolerance, right? So one possibility, patient is a case of cancer, taking opioids as a painkiller to relieve the pain, to improve the quality of life. Because one thing is there, the patient is not going to survive more, but as long as he's surviving, he can improve the quality of his life by taking these painkillers. So because of tolerance, which will develop gradually, he has to increase the dose of opioids. First possibility. Second possibility, patient is drug addict. So he has started taking opioids just for the purpose of fun or for the recreation, but gradually he has become addict of this medicine, and because of tolerance, he has to keep on increasing the dose day by day to have the more euphoria, to have the more fun which he was getting with the low dose. So in both cases, the patient has to increase the dose, right? Third possibility, like patient is admitted in hospital, or maybe the patient is at home, patient wants to commit suicide, or by mistake patient has taken the acute high dose of opioid, the third possibility. So in these three cases, patient might get poisoning, right? So the cancer patient will start taking the high dose of opioids, he will have this poisoning. Second, the addict can take the high dose to have the fun, to have the that euphoric effect of drug. Third, the patient has purposefully taken the high dose, or maybe by mistake he has taken the high dose. So in all these cases, patient will come to us with opioid poisoning. This is morphine poisoning, opioid poisoning we call it. Where the how will you recognize? The main problem is patient respiratory center will be down. So patient respiration will be down, patient cardiovascular center will be down. So in opioid poisoning, you will see patient respiratory rate, because the main reason for mortality here is the respiration rate will be down, patient blood pressure will be down, patient heart rate will be down. Now, apart from this, because if patient suffer from any poisoning, ultimately these two centers ultimately get involved, and these two are the main reasons for the mortality in any case of in case of any poisoning. But here you will have some associated feature. With the help of that, you can make the diagnosis. For example, the patient would be having the meiosis. So patient will be having the meiosis, and patient might give you the history that he has not passed the motion since last 2 or 3 days, or maybe for many days. So constipation history might be there. So I will write there history, because as a doctor you cannot find out the patient is having constipation right now. So constipation history will be there, meiosis will be there. Plus these are the findings which are responsible for main mortality in patients of opioid poisoning, right? Now here we will give an antidote, and the name of the antidote is naloxone. So naloxone is a drug which is used as an antidote of this opioid poisoning, and this naloxone is antagonist of all opioid receptor, that is mu, kappa, and delta. So there are three receptors of opioids. So whatever actions the opioid can do in our body, that can be antagonized by this medicine, that is naloxone. Now, guys, if I'm a patient who has taken opioids purposefully to commit suicide, if I will take naloxone in any dose, I don't have any problem. This naloxone is life saving for me. First possibility. Second possibility, if the patient is already a drug addict, or patient is already taking the medicine for a long time, like a patient who is having the cancer, and taking opioids for a long time as a painkiller. Now, if this patient will take high dose of naloxone, if you give high dose of naloxone as an antidote to these kind of patients, now try to understand their body is already dependent on opioids to do the normal activity. So when we become addict of anything, our body gradually become dependent on that thing. So our all body physiological mechanisms are possible when the drug is there in our body. For example, these patients are able to move their hands. They don't have the tremors. They can feel more confident. Their anxiety is relieved if the opioids are there in their body. Now, in these kind of patients, if you give naloxone and if you're given the high dose of naloxone, there is a possibility that the patient can get the inhibitory symptoms or the withdrawal symptoms. So, a patient who is a drug addict, there is a risk of withdrawal symptoms. So, high dose of naloxone can result in withdrawal symptoms in patients who are drug addicts or patients who are taking the medicine for a long time. Now, if you give naloxone, patient can get reverse of the opioid poisoning. For example, patient can have the tachycardias, patient can have the arrhythmias also. Patient can have the tachypnea also. Patient can have the high blood pressure. So patient can develop high blood pressure, tachypnea, arrhythmia, tachycardias, pulmonary edemas. So these complications can occur if you give high dose of naloxone to these kind of patients. So naloxone need to be given in low dose to these kind of patients. So the patient is addict, taking this medicine for long time. We have to give naloxone in a low dose, but the overall antidote of choice is naloxone. Now, here the confusion is there is one more antidote, that is naltrexone. So, guys, please remember naltrexone is a slow acting medicine. This medicine has slow onset of action, so I cannot use this medicine during acute emergency where the patient will have the opioid poisoning. So, naltrexone has a slow action, not given as antidote, but naloxone is given as an antidote. This was the first query which student have asked from me. Second query, if I want to take, that is regarding the warfarin. So one student has asked a query regarding a drug warfarin. So warfarin is an anticoagulant medicine. This medicine is an anticoagulant medicine. We all know this medicine can stop the coagulation. This medicine can stop the formation of a clot. And we all discussed during our lecture, this medicine has slow onset of action and the medicine will take 7 days to show its peak effect. So medicine will take 7 days to show its peak effect. For example, this warfarin is a drug when given to a patient. This medicine will inhibit one enzyme in liver. The name of the enzyme is vitamin K oxidoreductase enzyme. So during our lecture, we made a mnemonic of VCOR. If you remember the mnemonic VCOR, so vitamin K oxidoreductase enzyme is inhibited by warfarin in liver, and therefore this medicine can inhibit synthesis of clotting factor 2, 7, 9, and 10. So there are four clotting factor synthesis that will go down. That is clotting factor number 2, 7, 9, and 10. Now the first clotting factor that will go down, first clotting factor that is decreased in the plasma is clotting factor number 7, and that will start decreasing even after 7 to 8 hours. So immediately after giving warfarin, within 7 to 8 hours, you will find that factor 7 level will start declining, right? The last clotting factor that will decrease in plasma is factor 2. So clotting factor number 2 is the last clotting factor that will decrease in the plasma, and that will take only after 2 to 3 days. Now, once this clotting factor 2 will start declining after 2 to 3 days, now the warfarin action will start. Guys, got it? So warfarin action will not start till the time we have this clotting factor 2 in the body, because guys, you must be knowing clotting factor number 2 is the one, as long as it is present, it is keep on converting fibrinogen to fibrin. So this is our fibrin clot. So final one is fibrin. So as long as we have factor 2 in the body, our fibrin formation will continue, the clotting will continue. So warfarin action will start only after 2 to 3 days when the clotting factor 2 level will start declining, right? Now when the clotting factor number 2 will start declining, warfarin action will start. Now the peak effect of the warfarin. Peak effect of the warfarin will take only 7 days. So peak effect will take only after 7 days, because it will take long time for a body to reduce all the clotting factors, because the new clotting factors synthesis you have stopped. So warfarin has stopped the synthesis of new clotting factors. So whatever clotting factors are there in our plasma, those clotting factors will start declining gradually, and that will take proper 7 days so that you can see the peak effect of the warfarin. This is for the onset of action of the warfarin. When you stop warfarin, when you stop warfarin, what will happen? Now the vitamin K get activated in the liver. The moment you stop warfarin, vitamin K is now activated in the liver, and this vitamin K will start synthesizing clotting factor number 2, 7, 9, and 10. So 2, 7, 9, 10 synthesis will start. When the synthesis of this clotting factor will start, First of all, their stores in liver get filled up. So they will not start coming out in the plasma directly. First of all, their stores get filled up in the liver. And once their stores get filled up in the liver, then only they will start appearing in the plasma. So these clotting factors will start appearing in the plasma only once the stores of these clotting factors get filled up. Now, if you ask me which clotting factor will come first, it's not like that. It's about that like after after 4 to 5 days. After 4 to 5 days, if the patient will get any injury or the patient require clotting, all these four clotting factors are capable enough to initiate a clotting, right? So 2, 7, 9, 10 are capable enough to initiate a proper clotting only after 4 to 5 days of stopping the warfarin. So warfarin has slow offset of action. It will take 4 to 5 days for a warfarin to stop its action. Then only the proper clotting will start. So warfarin has fast, slow onset that will take peak effect only after 7 days, and warfarin also have slow offset that will take 4 to 5 days. So if a patient has to undergo surgery, like patient is on warfarin therapy and patient has to undergo surgery, because the clotting cannot take place, there is a risk of bleeding during surgery. So we have to stop such type of medicine, which can lead to more bleeding during surgery and patient can die during surgery on table. So if the patient has to undergo surgery, we have to stop warfarin. We have to stop warfarin how many days before surgery? Answer is minimum 4 to 5 days. So you have to stop warfarin minimum 4 to 5 days before surgery. This is the way to stop the warfarin, right? The second query you people have asked about this onset and the offset of this warfarin therapy, right? Now question number 3 which you people have asked, let me check the list of the questions which I have received from the technical team regarding these questions. So morphine poisoning we have attempted, warfarin thing we have discussed. Okay, serotonin receptors. So third thing you people have asked about the serotonin receptors. So guys, serotonin receptors, like medicines that will act on serotonin receptors. Medicines that will act on serotonin receptors, you people have asked, right? So let me tell you, as such, this topic is not important for the exam. Like morphine topic was very important. Warfarin topic was ultimate important, even more than the warfarin, more than the morphine topic, right? But serotonin receptor drugs is one topic that you people have asked, so I will discuss over here, don't worry. But this topic is less important for the exam. So if we talk about this serotonin receptor, you people must be knowing serotonin is written as 5-HT. It is 5-hydroxytryptamine. So we write this serotonin as 5-HT, right? Now this serotonin has 7 types of receptor mainly. So we have serotonin 1 receptor, we have serotonin 2 receptor, serotonin 3 receptor, we have serotonin 4 receptor, and then we have serotonin 5 to 7 number of receptors. So different types of receptors we have. Now, if we talk about serotonin 1 receptor, this is a type of inhibitory receptor. This is a type of inhibitory receptor that is known as serotonin 1 receptor. Now, this receptor has many subtypes. This receptor has many subtypes. For example, we have serotonin 1A, we have serotonin 1B and 1D. So we have serotonin 1A, 1B, 1D. We also have serotonin 1F. But for your examination point of view, as a dental student, this is not important to know the other subvariants of the serotonin 1. So for your examination point of view, just remember we have serotonin 1A, we have 1B, we have 1D. We don't have 1C. We don't have 1C in between. We have 1A, 1B, 1D. Then we have 1E, 1F, 1G. So those drugs that will act on 1F and all, those drugs are not important for the exam. Just concentrate over here, right? So the medicine that will act on serotonin 1A receptor, drug name is buspirone. So we have a medicine that is known as buspirone. So buspirone is a drug. It's an anti-anxiety medicine. So this medicine is an anti-anxiety medicine that is given for the treatment of anxiety disorder. Drug name is buspirone. So students, make the mnemonic like this way. Whenever we wait for the bus on a bus stop, the bus will come, the anxiety is gone. So the moment the bus will come, the anxiety is gone. So buspirone. So the moment you will take the bus has come, the anxiety is gone. So buspirone is an anti-anxiety medicine. Now we have the medicines that will act on serotonin 1B and 1D receptor together. So we call them triptans. So the medicines are known as triptans that will act on serotonin 1B and 1D receptor, right? So guys, if you have any doubt, you can please type on this chat because I'm waiting for your queries in live chat. In case you have any query, please ask me here, right? So I'm also checking the what's this Telegram group. So side by side. So in case you have any doubt, please you can type over there also. So triptans and the ergot derivatives. The drug is ergotamine. So triptans and the ergot derivatives will act on serotonin 1B, 1D receptor, and these medicines are given for the treatment of migraine. These medicines we use for the treatment of migraine. Now we have the serotonin 2 receptor. Now please remember guys, serotonin is a type of excitatory receptor. It's a type of excitatory receptor present in human body. It's a very common receptor of human body, which is a type of excitatory receptors. So we have medicines that will act on this serotonin 2 receptor and block the serotonin 2 receptor and can lead to inhibitory changes in the body. For example, we have the second generation antipsychotics. So the medicines are known as second generation antipsychotics. So second generation antipsychotics, like we have the medicines like clozapine, we have the medicine olanzapine. So second generation antipsychotics will act on serotonin 2 receptor of the brain and can stabilize the brain neurons. So second generation antipsychotics will act on the serotonin 2 receptor. We have the medicines like cyproheptadine. So we have the medicine cyproheptadine. So this medicine we also use for the treatment of carcinoid syndrome. So we can use this medicine for the treatment of carcinoid syndrome. We can also use this medicine for the treatment of dumping syndrome. So useful for carcinoid syndrome, dumping syndrome. Drug name is cyproheptadine, blocker of the serotonin 2 receptor. Right, guys? Now, apart from that, we have many other drugs which will act on serotonin 2 receptor. For example, ergot derivatives. So, ergot derivatives will also act on this receptor, right? We have a medicine like topiramate. So, topiramate is an anti-epileptic which also have this effect on serotonin 2 receptor, right? Now, serotonin 3 receptor. Now, serotonin 3 receptor is involved in chemotherapy induced nausea vomiting. So, it is involved in nausea vomiting associated with cancer drugs. So, chemotherapy induced nausea vomiting. So, if you want to treat chemotherapy induced vomiting, we can give the medicines. All these medicines end with the word citron. So, we have examples like ondansetron. So, we have the examples like ondansetron. We have the example like palinositron. So these medicines are given as a blocker of 5-HT3 receptor. These medicines are given for chemotherapy induced nausea vomiting. Now if we talk about serotonin 4 receptor. Now serotonin 4 receptor is present on GIT wall. It is present on the GIT cells, right, and is involved in peristalsis. So this is the receptor involved in peristalsis. This can increase the peristalsis of the GIT. So whenever we want to increase the peristalsis, medicines are known as prokinetic drugs. Medicines are known as prokinetic drugs, like we have the medicines like Cisapride. We have the medicine like Mozapride. So we have the drugs like Cisapride, Mozapride. These medicines are given for the treatment of GERD. So medicines are given for the treatment of GERD. So these medicines will act on 5-HT4 receptor. Last is medicines that will act on serotonin 5 to 7 receptors. So these medicines can stimulate or can inhibit serotonin 5 to 7 receptor. We have the medicines, we call them second generation antipsychotic again. So second generation antipsychotics will again act on serotonin 5 to 7 receptor. They can stimulate some of the receptor, they can inhibit other receptors. So we call them as a modulators of these receptors, right? So these medicines will act on serotonin 5 to 7 receptor. We have some antidepressant also. Some antidepressants will also act on serotonin 5 to 7 receptors. So this is a list of the medicines that will act on type serotonin receptors. So we have discussed all these medicines in the respective groups. So while during the regular batch lecture, we have discussed all these medicines in the respective groups. But here you people have asked the query, so I have consolidated all the medicines in one slide. Now, yes, I'm so happy to see that you people have started asking the question, and I really like that you people ask these queries. So Dr. Sudhashri Panda has asked the question: these drugs are inhibitory or agonist of 5-HT1? Okay, fine, no problem. Sudhashri Panda, you can see this is a inhibitory receptor. So whenever we stimulate a inhibitory receptor, now this will lead to inhibitory changes in the CNS. We have stimulated a inhibitory receptor. So like if we have stimulated this 5-HTA receptor, now what will happen? Our anxiety center, our anxiety pathway will be inhibited. So we have a anxiety center, we call it amygdala. So in brain we have various centers which are involved in anxiety. So this is involved in inhibiting the anxiety pathways. So anxiety pathways are inhibited if you stimulate a inhibitory receptor. Similarly, when I stimulate serotonin 1B, 1D receptor, Now these receptors are connected with your pain pathways. So what will happen? Your pain pathways of CNS, your pain pathways of CNS will be inhibited. So your pain pathways of CNS will be inhibited, so you will not have the pain. Second, when you stimulate this receptor, you will also inhibit the release of a chemical that is known as CGRP. So CGRP is a chemical that is involved in pathophysiology of migraine. So on one side, we have inhibited the pain pathway. On other side, I have inhibited the chemical that is involved in this migraine pathophysiology. So I can treat the migraine by stimulating serotonin 1B and 1D receptor, because these are the inhibitory receptors. So here the most important point is this is inhibitory receptor. Rest all are stimulatory receptor. Like if you ask me, sir, what about the other receptors? All other receptors are stimulatory. All other receptors are stimulatory, but 5-HT1 receptor is inhibitory type of receptor. So accordingly, you can find out these medicines are agonist of this receptor. Okay, so Dr. Naimur Rehman, allopurinol and xanthine oxidase. Do we need to go with competitive or society inhibitor? Dr. Naimur Rehman, this is a all-time controversial question. Now look at here. See, allopurinol is a medicine. This medicine is a competitive blocker. This medicine is a competitive antagonist of xanthine oxidase enzyme. This is a competitive antagonist of xanthine oxidase enzyme. First thing, right? Now, after liver metabolism in human body, this is converted to oxypurinol. So this medicine is converted to oxypurinol in human body. So after liver metabolism, this is converted to a metabolite. The name of the metabolite is oxypurinol. Now, oxypurinol is the one that will go and again bind to the xanthine oxidase enzyme. So this is also a competitive antagonist. This is also a competitive antagonist of xanthine oxidase enzyme. But the unique point is this competitive antagonist, this block which is produced by this medicine is very strong. Look at here, guys. What is competitive antagonist? If I say this is the enzyme, assume this is a xanthine oxidase enzyme. So whenever I give a blocker, so B stands for blockers here, this is a blocker. Now this blocker will go and occupy the same site which is required by the normal substrate of the body, right? So if I say the normal substrate is xanthine, so xanthine wants to bind over here and you have given a blocker, the blocker will also bind over here. This is the competition between xanthine and the blocker. So the xanthine is not able to bind with the enzyme, so the metabolism is not possible. So this blocker is allopurinol. That's fine. It's a competitive blocker. Now this blocker can be oxypurinol. Now the problem is when the oxypurinol will go and bind to the site. Now oxypurinol will not get dissociated for a long time. This will remain over there. The only change is this. Although it's a competitive blocker, but this will not get dissociated easily. This will take very long time to get dissociated, right? So guys, there is a one type of inhibition, we call it irreversible inhibition. But you can see over here, this is a competitive block, right? But this get dissociated after a long time, right? So it is not a true irreversible block. This is also not a true irreversible block. Irreversible means the enzyme is permanently gone. Now the body has to make the new enzyme. But in this case, the enzyme is not permanently inhibited. Oxypurinol will go and bind to the enzyme. It's a competitive blocker, and now it will not get dissociated for a long time. So I will say this medicine will form a pseudo irreversible block. So guys, technically we call it pseudo irreversible block, but according to some books of biochemistry, this is also known as suicidal inhibition. This is known as suicidal inhibition, but this is not a true suicidal inhibition. This is pseudo suicidal inhibition, right? Now the things are in front of you. I've discussed these things in detail. What exactly you want to mark? Would you like to mark as a competitive blocker, or you would like to mark as a suicidal inhibitor? So according to me, you should go for competitive blocker, because your drug is allopurinol. You can see they're asking about the allopurinol, they're not asking about the oxypurinol. So allopurinol they're asking. So according to me, allopurinol is a competitive blocker. Oxypurinol is also a competitive blocker, but the block is pseudo irreversible, which we can call suicidal inhibition. But again, the answer is, according to me, is competitive blocker. This is what the answer I can give you. So Dr. Naimur Rehman has asked one more question. Mechanism of resistance to penicillin via beta lactamase is due to the altered penicillin binding protein, or it breaks the structure. Oh, acha, okay, this is the confusion. No problem, guys. I'll teach you. So, Dr. Naimo, try to see if I discuss about the resistance which bacteria can develop against a beta-lactam antibiotic. Right? So, against the beta-lactam antibiotics, how the resistance can be developed by the bacteria, right? So, assume this is bacteria. This bacteria can form one enzyme on its outer surface. So, bacteria can secrete one enzyme on its outer surface, and the name of the enzyme is beta lactamase enzyme. So, name of the enzyme is beta lactamase enzyme. Now you can see the name of the enzyme is beta lactamase. It can break the structure of the beta lactam antibiotic. So if I draw the structure of a beta lactam antibiotic, so guys, whenever the structure will come in your exam, you will find that whole antibiotic, there is a huge structure of the antibiotic, but there is a one ring which is a square ring. Guys, you must be knowing benzene ring is there. So benzene ring has six sides, right? But along with the benzene ring, you will find a square ring. So this square ring is actually a beta lactam ring. So this is the property of a beta-lactam antibiotic, that they have the square ring present in the structure. We call it beta-lactam ring. Now in this beta-lactam ring, guys, on one side we have a oxygen and other side we have a nitrogen. Now what the beta-lactamase enzyme will do? Beta-lactamase enzyme will go and break this ring. So beta-lactamase enzyme will go and break the beta-lactam ring. This is the method by which this antibiotic become denatured. So antibiotic become waste against this bacteria because bacteria has secreted one enzyme on its outer surface. Now this enzyme will go and break the structure of this beta-lactam ring. For example, this antibiotic is penicillin. So when you people discovered penicillin against bacteria, bacteria started producing beta-lactamase enzyme. Now, how you have protected this penicillin? You have started beta-lactam antibiotic. You started giving beta-lactam antibiotic along with beta-lactamase enzyme inhibitor. You people have started combining beta-lactam antibiotic with the beta-lactamase enzyme inhibitor, so that beta-lactamase enzyme will go and inhibit the enzyme first. So when you give the beta-lactam antibiotic along with beta-lactamase inhibitor, beta-lactamase will inhibit the beta-lactamase inhibitors will inhibit the enzyme. Now the antibiotic will kill the bacteria. One classical example is amoxiclav. And this question, guys, they have asked you in your INSTT exam, that whenever you combine clavulanic acid with amoxicillin, this is which type of drug combination? So we discussed already, this is a type of supra additive. This is a type of supra additive, and we also call it drug potentiation. We also call it drug potentiation. It is supra additive action. It's not additive, it's supra additive. Now guys, why we call it supra additive? You can see here clavulanic acid is not given against bacteria. Our main target is bacteria, so antibiotic is given against bacteria, but clavulanic acid is not against the bacteria, it is against something else. But in the presence of clavulanic acid, your amoxicillin will work better. So I will say here the clavulanic acid is muted component. Muted means the zero activity against bacteria, but amoxicillin activity is increased in presence of clavulanic acid. So I will say the addition of clavulanic acid with amoxicillin is a supra additive effect. It's a drug potentiation, right, guys? So when the bacteria started producing beta lactamase enzyme, we people discovered beta lactamase inhibitor to overcome the problem. Now when we have overcome the problem, what the bacteria did? The same bacteria which initially produced beta lactamase, this bacteria which is already producing beta lactamase enzyme, this bacteria which is already producing beta lactamase enzyme, this bacteria changed the target of antibiotic. Although you have beta lactamase inhibitor, like if I give amoxiclav against it, if I give amoxiclav against it, so clavulanic acid will go and inhibit this enzyme, and amoxicillin will go and inhibit penicillin binding protein in bacteria. So amoxicillin will inhibit the bacteria by inhibiting the penicillin binding protein. So when bacteria observed that you people have discovered beta lactamase inhibitor and you're using the same antibiotic, so bacteria change the target of the beta lactam antibiotic. And when the bacteria change the target of the beta lactam antibiotic, now this whole preparation has gone. This is wasted. The bacterial resistance is developed. And now here they will ask which bacteria came into the picture. This bacteria is known as MRSA, methicillin resistant Staph aureus. And that is why there is a need which was felt at that time to discover an antibiotic which should be a cell wall inhibitor like amoxicillin, but that antibiotic should not block penicillin binding protein. So they discovered, So they discovered an antibiotic which is a cell wall inhibitor, but the target of the antibiotic is not penicillin binding protein. The target of the antibiotic is something different. Now, who will tell me which antibiotic they discovered against MRSA, which is also a cell wall inhibitor, but the target is not penicillin binding protein? This is a homework for you to find out. In case you know the answer, you can just type it here in the chat. Yes, it's a synergistic effect. Yes. So, Dr. Sudhashri Panda, if I talk about drug synergism, if I talk about drug synergism, so drug synergism is a broad term, right? I told you I have also taken the reference of KD Tripathi. So if I talk about drug synergism, so drug synergism can be of two types. There can be a additive effect. There can be a supra-additive effect. Now, what is the additive effect? Additive effect means both antibiotics have same target, right? So both antibiotics are given against the same target. For example, you have combined two antibiotics together. For example, if I give combination of amoxicillin plus azithromycin, if I give combination of amoxicillin plus azithromycin, so both antibiotic are against a target, that is a bacteria. So this effect is going to be 2, that is additive effect. So this is the additive effect when both medicines are against a given target. Now, supra-additive means when you give two medicines together, but one medicine has zero activity. One medicine has zero activity against a given target. That drug is muted effect. But in the presence of that medicine that is not going to inhibit the target, the overall effect is going to be more than one. So overall effect is going to be more than one. So the antibiotic effect is even more than the normal antibiotic effect. So if I give only amoxicillin, the overall effect is less in presence of beta lactamase. But if I give this with clavulanic acid, so although clavulanic acid is not acting against bacteria, but amoxicillin activity is further increased, which has become more than one effect. This is supraadditive effect. We also call it potentiation. We also call it potentiation, right? So this is the question they have asked you. So now you can recall, because I was not the one who was appearing in the exam. So if this option is there, this was the better answer. If this is not given in the exam, the second best answer is definitely this, doctor, right? The second answer will be definitely drug synergism, right? So accordingly, you can choose the answer. The best answer, supraadditive or drug potentiation. Second best answer, no doubt, drug synergism. But this is not the drug addition, right? Yes, very good answer, guys. So Dr. Gaurav and Dr. Sudhashri has answered. The cell wall inhibitor which was discovered against MRSA is vancomycin. So vancomycin, the drug which is cell wall inhibitor that we have discovered against MRSA, right? So this was the queries. Uh, these were the queries actually. So antiemetics. So one more query students have asked about the antiemetic medicines. So guys, anti-emetic is a topic which is very, 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 very important for your exam. So whether you're preparing for dental PG or you appear for NEET PG medical side or you're preparing for INSCT, this question is definitely will be there in your exam. Like they will not ask you the drugs act on peptic ulcer disease. I'm telling you, proton pump inhibitors are not important for the exam because the examiner already know that you people already exhausted this proton pump inhibitor. So don't attempt questions in detail regarding PPIs. So PPIs is a less important topic, but antiemetic is a very important topic for the exam. Especially the antiemetics like medicines which are given for chemotherapy induced vomiting. So anti-cancer drugs, when you take the cancer drugs can cause vomiting. We call it chemotherapy-induced vomiting. So this cancer-induced vomiting can occur within 24 hours. We call it early vomiting, and this can occur after 24 hours. We call it late vomiting. So we have a early vomiting, we have a late vomiting. So if we talk about the early vomiting, so drug of choice or the best medicines for early vomiting, we have discussed before this question, that is 5-HT3 blocker. So all these medicines end with the word citron. So all these medicines end with the word citron, like we have the medicines palinositron, ondansetron. These medicines are there. But for delayed vomiting, we have the medicines, we call them substance P inhibitors. Medicines which are substance P inhibitors, all these medicines end with the word patent. So all these medicines end with the word patent. Like for example, one drug is apripitant. So we have a medicine like apripitant. So this guys we discussed during our lecture also, and we made a mnemonic also. Like what was the mnemonic? If you come early, like you are coming for the lecture, If you come early for the lecture, you will get seat in the lecture theater. So if you come early, you will get seat. If you come late, you will get pit to sit. So all these medicines end with the word pitent, right? So when you come early, you will get seat. If you come late, you will get pit. And if you understand Hindi, we also made a Hindi mnemonic during our lecture. Like if you come early, आपको मिलेगा seat lecture theater में. If you come late for the lecture, आप पिटोगे. So पिटोगे means you will be beaten up, right? So if you come late, you will be beaten up, or if you come early, you will get seat. You will be offered to sit on a seat, right? This is for the chemotherapy induced vomiting. Now, apart from this chemotherapy induced vomiting, guys, second type of vomiting that can be asked in your exam is motion sickness. So vomiting that can occur due to motion sickness, air sickness, sea sickness, any question they will ask you. So what vomiting that will occur due to motion sickness? So drug of choice you will mark as a hyoscine. So hyoscine, which is also known as scopolamine. Also known as scopolamine, this is a drug of choice, but I'm 100% giving you the guarantee that hyoscine will not be asked in relation to motion sickness. If the question is asked on motion sickness in your exam, the answer would be promethazine. I'm telling you this, please note it down. Hyoscine will not be there because in India we don't have hyoscine for the motion sickness, but we have promethazine as a drug. So for motion sickness in your exam, if the question will come, promethazine, try to find out. Hyoscine would not be there. I'm giving you the guarantee for this. So promethazine will be the best answer you can find out in your exam, because in Indian exam they can trap you in this kind of things. Now, third vomiting, they can ask you, like for your dental PG, they will not ask you the morning sickness. So one more vomiting that will occur in the pregnant females. So pregnant females can have the morning sickness. So this vomiting is morning sickness. This will not be asked in your exam. So I will not covering which medicine is the best medicine for morning sickness. So I'm directly moving on to the any other vomiting. So now, apart from this morning sickness, motion sickness, and chemotherapy induced vomiting, apart from that, if there is any other vomiting history is there, any other vomiting is there, guys, you must be knowing as a doctor also. Your relatives, your friends call you, ki, sir, which medicine should I take? Ma'am, which medicine should I take? You have only two options. Either you give dopamine blockers or you give serotonin 3 receptor blocker. These are the only two options we have. If you start your treatment with dopamine blocker, patient vomiting is not controlled, you switch to this. And other way around also true. If you start with 5-HT3 blocker, patient vomiting is not controlled, you switch to this. Not switch, you add basically. If dopamine blockers not able to control, you add 5-HT3 blocker. If 5-HT3 blockers not able to control, you can add dopamine blockers. So it's totally up to you guys. Depends on your tie-up with the pharma company. You can start with any of the group, but later on you can add the second group in case the vomiting is not controlled. Right? Now 5-HT3 blocker. Which 5-HT3 blocker is very commonly used in day-to-day practice? The answer is Ondem. So Ondem is the drug, Ondansetron we call it. So Ondansetron is a medicine that is very commonly used in day-to-day practice. Now whenever you give this medicine to a patient, you tell the patient that he can have the headache. So headache is the most common side effect of the medicine. This medicine can also cause constipation. So if a patient is having diarrhea with vomiting, constipation will relieve the diarrhea symptoms also. So constipation can occur, headache can occur as a common side effect of the medicine. Now the medicines which are dopamine blockers. Medicines which are dopamine blockers, here you have the two options. One is known as domperidone. So domperidone is a medicine that we commonly use in day-to-day practice. Second is, which is comparatively more efficacious, metoclopramide. So metoclopramide is one more medicine that we can give. Now out of these two, metoclopramide is the one that can cross blood-brain barrier. So this medicine can cross blood-brain barrier. We call it metoclopramide. And after crossing the blood-brain barrier, this medicine can cause dopamine deficiency in central nervous system. And because this medicine can cause dopamine deficiency in central nervous system, this medicine can cause Parkinson's like symptoms. We also call it extra pyramidal symptoms. We also call it muscle dystonia. So patient can develop muscle dystonia. Patient can develop body movement problem. So patient can have body movement disturbances. Body movement problem will be there. EPS will be there. Extra pyramidal symptoms will be there. Parkinson's like symptoms will be there. Muscle dystonia will be there. And guys, does not matter how much space you have in your copy. If you can write down, you can write down. This is very, very, very important point. I'm telling you, last 5 years, this question is asked around 7 times because you have 3 exams per year. So this question is asked 7 or 8 times in your exam. Even last year in NEET exam, this question was there. This time in FMG exam, this question was there. This is very, very important question that metoclopramide is a medicine. This can cross blood-brain barrier and can result in muscle dystonia, body movement disorders. Now, domperidone is a medicine that will not cross blood-brain barrier. So this medicine cannot cross blood-brain barrier. So this medicine has no CNS side effects. So this type of side effects are not seen with domperidone. Now, guys, this time what I can think of, they can ask you QT prolongation, medicines which can cause QT prolongation. So please concentrate on the medicines. Please, you can remember the names of the medicines which can cause QT prolongation. Like for a dental student, you must be knowing painkiller is a topic, analgesic is a topic which is very important for you. So there is a analgesic drug methadone. Methadone is an analgesic medicine. It's a opioid basically. This medicine can cause a side effect of QT prolongation. This is very important. So what I can think, because this question is asked in NEET exam, INA CT exam this time in the medical side. This is one of the expected MCQ that can be asked, right? Drug clearance and kinetics of elimination. You want to know about the kinetics of elimination and drug clearance. Okay, so kinetics of elimination, first order and zero order kinetics are there. And most of the time, first order, zero order kinetics not asked. So if you want to cover, if you want me to cover, I will cover. Otherwise, so we can skip this topic of first order, zero order kinetics. Just remember in first order kinetics, please remember 4 points, right? 4 points are T half remain constant, right? Clearance remain constant. So half-life remain constant, clearance remain constant. So plasma clearance remain constant, half-life remain constant. But if we talk about zero order kinetics, if we talk about zero order kinetics, T half is directly proportional to the drug dose. So it is not constant, it is directly proportional to the drug dose. Clearance is inversely proportional to the drug dose. So clearance is also not constant. So here the clearance is variable, T half is variable. So half-life is variable, clearance is also variable. Now in first order kinetics, fraction of drug that is eliminated, fraction of drug that is eliminated from the body, this is also constant. So fraction of drug that is eliminated from the body is also constant, but in zero order kinetics this is also variable. So fraction of the drug that is eliminated is also variable, right? But here the only thing which is variable is, in first order kinetics, the only thing which is variable is rate of elimination. So rate of elimination of drug is also known as amount of drug eliminated from the body. So amount of drug eliminated from the body is variable. So this is variable and this is directly proportional to the dose. This is directly proportional to the dose, but the same rate of elimination in zero order kinetics is constant. So guys, have you noticed one thing? Everything is constant in first order kinetics. Everything is constant in first order kinetics except rate of elimination. And in zero order kinetics, everything is variable. In zero order kinetics, everything is variable except the rate of elimination, which is constant. Right, guys? And after that, you can remember 3 or 4 examples of the medicines which follow zero order kinetics. But why this question is not asked in the exams, you must have noticed in your dental exam also this question is not there. The reason is because practically we don't face this problem of zero order kinetics. We know that a drug in high dose will start following the zero order kinetics, so we never give those medicines in high dose, right? Like warfarin is one of the example, phenytoin is second example. So we don't give these medicines in high dose to the patients, so we practically don't face this issue, right? So that's why these questions are less commonly asked, right, guys? So I hope I have taken all these queries, whatever queries you people have asked, I'm able to answer those queries, I hope. So guys, even after that, if you have any query, you can also message me directly on this number. So this is my WhatsApp number. In case you have any doubt, you can message me over here. Now, guys, you have 2 months which are left for your exam. So many students are asking, say, how to approach pharma. Like pharma is a very volatile subject. Everybody knows. Like if you read today pharma, tomorrow you will forget about the medicines. That's fine. So how to approach this topic in the next whatever days are left for your exam. So guys, first approach I told you, you have to go for the smart studies, right? Smart study means you have to just read the important topics. I'm telling you, this is a medical subject for you. This will not bring the rank to you. Rank is given to you by the dental subjects, right? So only read important topics, right? So whatever test and discussion we have kept, you can just follow the questions and the relative respective topic in your notes. Just read those topics. So smart study means you can save your time in pharma, read only important topics. Second question students are asking is, sir, should we give more time to the pharma because pharma is volatile? Like whenever we study, after a few days, it gives us a feeling that it's the subject is not there in our mind. So guys, my answer is no. Basically, because you people have made a schedule, right? So don't waste your time. Don't give extra weightage to any subject. So in one subject, you are already weak, right? So this is not the time to work upon your weakness. Right to understand, you are in the phase of your life, like you are in a phase of your preparation for the exam, when you are left only with two, maximum 2 months, right? So you are very, this time is very crucial for you. So this time if you start working on your weakness, and even then there is no guarantee that you will be able to overcome your weakness. So there is no guarantee for that. Ultimately what will happen, you will end it up with a wasting your time. First thing. Second thing, also there is no guarantee, like if you give so much time to the pharma, there's no guarantee that in exam there is so many questions will come from the pharma and those questions will be difficult and you are able to solve it, other students are not able to solve. There's no guarantee of that. Third, maybe there is a possibility that questions which will come from pharma is going to be very easy. So even you don't give any time, even if you give the usual time to the pharma, maybe those questions will be so easy you will be able to crack those questions. So my suggestion is, do not give extra weightage. Do not give extra weightage to any of the subject, including pharma. Please make your schedule, go with the schedule, because you're left with very less time. So make a schedule that how much time you have to give to a subject. So according to the subject, according to the importance of the subject, give importance to, give the proper respect to the subject, give them the proper time, and read the subject according to the schedule. Do not give extra weightage to pharmacology, right? Second thing. Now, still, if you ask me, sir, what we will do in the last week, like when we are left only with 1 week, we have already done with all the revision. Then what should we do in the last week? Yes, the last week is crucial, because in last week you can keep those subjects for the last revision which are volatile, right? So in last week you can keep the volatile subjects with you. So volatile subject revision, like you have already done 2 or 3 times revision of the volatile subjects. Now the last week is left. You can keep the volatile subject for the last minute revision, because these are the subjects that will give you marks and you will not forget about the subject if you have revised them in the last week. Right, guys? Because if you will not read these subjects in the last week, this is high possibility that you can mark some questions wrong, which are easy one. So keep the volatile subjects for the last week, which include pharma, no doubt about that, right? So last week you can keep the pharma, you can keep half day, maybe 12 hours, so maybe 18 hours for the pharmacology, and rest of subjects you can keep, rest of time you can keep for the other subjects, right? And like if you ask me from the medical side about the medicine, like medicine is one of the subject in our medical side which I suggest not to read for the last minute revision, because medicine is a subject which is totally conceptual. You must have noticed, like after reading medicine, and you must be having some dental subjects also which are conceptual. So any subject which is conceptual, which has lot of concept, although those subjects are very interesting to read, like whenever we read those subjects, it's just like a novel. So guys, do not keep that subject for the last minute revision, because that, even if you revise that subject for the last week, or if you revise this subject, if you give more time to that kind of subjects which have lot of concepts, that will never give you more marks. Like if today I'll tell you to mark the to mark 20 questions of medicine. So 20 questions of medicine if I'll give you, and you are not come prepared for the medicine class, right? And now you can easily solve 10 questions. I bet you, I give you the guarantee that 10 questions you can easily solve without preparing for the medicine. Now, medicine is such a vast subject. Even if you spend, for example, you have given 4 to 5 days for the medicine. So after giving 4 to 5 days of the medicine, now you have come prepared after you have come to the exam after preparing for the medicine. Now I'm giving the guarantee that you cannot score more than 12 to 13. Right now, if I talk about the volatile subject like pharma, like today, if I ask you how many questions you can solve without reading pharma out of 20, you can only score 7 to 8. But after giving 4 to 5 days for the pharma in the last minute revision, this is applicable to all volatile subjects, right? Now, easily you can score 14 to 15 questions. This is the difference they can create. So, conceptual subjects always remain in your mind. So, whether you read them or you don't read them, they will not make a extra difference or significant difference in the exam. But if you read the volatile subjects or your weak subjects for the last minute revision, like last 1 week revision, this will definitely create a difference, right? So, keep your schedule with you in these normal days. Keep on going with the normal pace, keep on doing the test side by side, but keep your this pharma subject or just this pharma like other volatile subject for the last minute revision. This is my suggestion, this is my personal opinion, right? You should follow like this way, right? So guys, in case you have any other question, please ask. because it's already been 1 hour that we have started. So, Dr. Naimur, Rehman, Dr. Sadashri, Dr. Gaurav, Neelam, thanks for participating in this chat, because without you people, this session was not successful at all. Because you people were there, you people were asking questions. So, it was great for me also to uh, prolong this session for this 1 hour. And thanks for the participation. Again, I will say, guys, my all wishes are with you. Please prepare hard, keep on working hard, keep the momentum with you. The future is yours, guys. Right? For any doubt, please don't hesitate to message me, don't hesitate to call me in case you have any doubt, in case you have any problem. Please call me. Right? Take care, guys. Have a good day. Good night.